I'm running into some resistance down here, which I didn't anticipate, so you can't really see. She's a little thickening of the tissue here, so you really can't see the tracking like you did. There you can see it a little bit there. Okay. Okay, I'm going to ask you to eyes while I move around to the other side. Okay, I always start with the vermilion border in these patients. Sort of use that as a guide. Her vermilion border at the bottom is not quite as well defined as at the top. And I'm getting a little bit less resistance on this side than I did on the other. But I'm still getting some resistance, so I'm just going to re-inject here. I'm going to thread it a little bit, a couple of these places, because of the resistance I'm getting. I'm just not getting it to push along. And a little bit in the body. With the lip, because of the swelling, I often check my syringe just to see if I'm putting in equal amounts as well, because sometimes you can't tell. And also the local anesthetic will distort the lips. The patient can't really hold the lips well, so sometimes you really can't tell because of that distortion just how even it is. Okay, I want you to say ooh like this if you can. Can you stick your lips out? Not very well. Okay, can you smile? Try to smile. Okay, I still think she has a little bit more over there, so I'm going to inject a little bit more in the body here. Okay, relax. And then I'll have her take a look. Again, meeting some resistance here. But I'm trying to get that proportion right. In some patients, you actually have to inject along the wet-dry border. That is, this border as the mucosa changes to the actual skin of the lip. Sometimes patients need injections along that edge to evert the lip because their lip is just so narrow that they don't have much lip tissue to inject into. Jelena doesn't have that problem, but there are multiple techniques that can be used to alter the appearance of the lip, and you have to have a lot of experience to really understand which areas need to be injected to achieve the look that you are seeking. So I have just completed injecting the lips for Jelena. We gave her a dental block of a total of 2 cc's of 1% xylocaine with epinephrine to numb the lip area so that she would not be quite so sensitive to the injection of the Juvederm. I first injected along the vermilion border of the upper lip and then in the body. Now Jelena has a little Restylane in her lips from a previous injection, so she had a little bit of unevenness to her lips as the previous injection started to deteriorate, and I injected her a little bit less on the left because of that previous injection than I did on the right. But she also needed an extra injection of the xylocaine in the right side, so she may have a little bit of unevenness to her lips now that doesn't allow us to really to judge exactly what's going on. So we have to wait until this wears off a little bit more until we can really determine whether the lips are even. But I did palpate the Juvederm in the lips, and it does feel as though it is equal on both sides. I can also use that opportunity during the palpation to actually massage the hyaluronic acid back into place where I think it's going to actually be the most effective. I injected 0.4 cc's of the Juvederm into her lower lip, starting with the vermilion border. I noticed that she actually has some resistance to the Juvederm in this area, so it was a little bit more difficult to inject, and sometimes you can see that after patients have had several injections of soft tissue filler into their lips. But I think we're going to get an excellent result, and she'll be icing this area for about 24 to 48 hours to really get the lips to decrease in size. They swell so quickly you really can't tell how much has been injected until the swelling is reduced. So she will be asked to return to the office within a week so that we can actually determine whether we need to balance the injection out and make her lips look perfect. Jelena is with us today. She's returned for a reevaluation. She was looking to have some enhancement of her lips because she felt that that would help to balance the lower portion of her face. She really prefers having full lips and has actually had some treatments in the past. So she was given some Juvederm in the vermilion border of her lip as well as the body of her lip to give her more fullness. If you remember, one of the concerns is the proportion of the lips. She wants to have the bottom lip about 2/3 the size of the upper lip, 1/3 upper, 2/3 bottom. And I feel that we've really gotten close to achieving that goal. Her lower lip is fuller than her upper lip. She actually wants to have more Restylane or some kind of filler placed in her upper lip, but for now we're just going to let the Juvederm do its work. She feels that they're soft and pliable and is pleased with the result. When I'm using dermal fillers, I always look at the patient's face and evaluate the face to see exactly what needs to be done. And in Kelly, I noticed that she has just the slightest trace of a line developing here above the mentalis, just under the lower lip. And she also, when she depresses her chin a bit, is developing this line here just underneath the mentalis, or underneath the front of the mandible. And I feel that these areas would do very well with a slight amount of dermal filler here to help to erase that line. So I'm going to place just a small amount of Restylane in those areas. We have found that over time, if the dermal fillers are placed on a regular basis, and usually this particular filler will last from 4 to 6 months in the patients, that they will often start to repair the defect that you're seeing in the skin and will develop and regrow collagen underneath that defect so that they no longer have as prominent a line in those areas. That is, if they continue to get the treatments on a regular basis. So we may actually achieve quite a bit by treating these areas, and Kelly's very good about coming in and getting her treatments. So I'm just going to, again, use this magnifier so I can be sure I'm in just the right layer. I'm going to go in the deep dermis here. Again, I'm going to use a linear threading technique, and I'm trying to, you can see a little bit of blanching as I raise the needle. Sometimes you can use the Restylane as a deep dermal filler, not just in the mid-dermis. And we sometimes actually even use it a little bit more superficially, which I'm doing right now. And you can see a little of it coming out through her pores to give a little bit better effect. And let me just wipe that a little bit. And I'm just going to walk across this area. I find that it's very difficult to eliminate this line completely. Trying once again to get into the right layer.